Anxiety can sometimes make blood pressure very, very difficult to control. This is a well-known phenomenon in cardiology. And we, as cardiologists, generally can recognize this right away. So this is how you can recognize it. If a patient comes in with a blood pressure of 167, their primary doctor, or let's say you're the primary doctor, you've put them on several things that you would normally expect to really drop their blood pressure. Like you put them on lisinopril 10 and hydrochlorothiazide 12.5, and it really doesn't change. You double both of those, and it really doesn't change. So like 167, the next week it's 170, 1 week it's 159. Something's not right. You put them on hydralazine, carvedilol, you increase the lisinopril all the way up to 40. I mean, you do all these things, and the pressure doesn't really react. It just kind of stays at that high level. So what is actually going on? These are generally what patients that have high anxiety and anxiety-driven hypertension act like. When they're hypertensive and it's not coming down in the way that you would expect, it is probably anxiety-driven hypertension. So what we do in these cases is we need to treat their anxiety. Now, I recommend putting them on a long-term medication that treats anxiety kind of at its root and at its core, and it doesn't need to be dosed multiple times a day. Like you don't want to put them on Ativan or Xanax or benzodiazepines because obviously those work, but it's not a long-term solution. You don't want to put them on Buspar usually either because it's dosed twice a day, and if they miss a dose, it kind of wears off quickly and then they ramp up their blood pressure. You also don't want to put them on blood pressure meds that have a lot of rebound. Like you don't want to put them on clonidine tablets because when they wear off, your blood pressure skyrockets, and with their anxiety, it's going to skyrocket even more. You want to put them on long-term acting anxiety medications. These are things like Celexa, Lexapro, Wellbutrin, things like that. And you don't want to put them on like paroxetine or things like that cause weight gain, because that's just going to exacerbate the problems and make it worse. Something like Wellbutrin, acetalopram or citalopram, Lexapro, Celexa, those would be a good starting point.